Hi, Mehند.
Assalamualaikum.
Alaikum assalam. How are you doing?
Alhamdulillah, I'm alright, alright.
Yeah, it's good to know. How is your day going today?
Almost busy day, very, very busy day.
How busy?
And still, there's work, all of the work. There's
Yeah,
a lot of work in the morning.
yeah, I know. So you start to work in the morning or in the evening?
Um, I have both shifts. I start from 7 o'clock to 7 a.m. and I finish my first shift 5 p.m.
Mm-hmm.
And then like today I had shift from 5 to till
Yeah, so
6 a.m.
you have rotational shifts.
Rotational shift.
Rotational means like it's not fixed.
Like
Maybe today you have a
so
shift from 9 to 5, and tomorrow you have a shift from 5 to 9, and so on, or 5 to 1 a.m. or something. That's what I mean. So
no,
the
no, every day has I have the same shift in the morning.
yeah, so you have a fixed shift, a
No,
fixed
I mean it's different jobs. Like I have the one in the morning. I have it every day, and then
uh,
the other one like it's not every day. So sometimes I have it maybe 2 days 2 days a week. The one at night,
yeah. So you have two
maybe
jobs.
two.
You
Yeah,
work in
two
two
jobs.
jobs. Yes.
Yeah,
One of them is every day, the fixed one, and the
the
other
morning
one,
one.
yes, and the other one is maybe for 2 days a week or something, right?
Yeah, yeah, right.
Yeah, I got you now. That's nice. That's nice. And I didn't expect from someone in your age to work or to have two jobs. You know, it's uncommon
Well,
thing.
I have three actually.
You actually have three jobs.
Yeah, I still have one after this course.
Yeah, I understand. So good luck. Like I hope you achieve all your goals.
I wish.
Yeah, I hope so.
I hope so.
Yes. Okay, so in the previous session, we talked about waking up and getting up habits.
Yeah.
Today, we're going to be talking about something different, which is seeing a specialist. You know the meaning of specialist?
A specialist like um they're like doctor but like the specialist I don't know how to explain it. I know but I don't know how to explain it. But I don't know but I know about what's that mean. Like
Yeah. So
like the
try to explain.
doctor like the doctor. But the specialist is like it's more special in that thing.
Yes, is more specialized in this thing.
Yeah, it's more specialized in this thing.
Yes. So if you have a specific issue, a specific health
Yeah.
issue, so you don't go to the GP. So we have two kinds of doctors. We have the GP,
Yeah.
which is
GP, that's like the general doctor or something like that.
exactly the general practitioner.
Yeah,
Yeah. So if
because here if you have anything, you have to go to the GP first, and then the GP transfer you to the specialist.
yes, the
So
GP
you cannot
refers.
you cannot go the specialist straight away.
Yes, exactly. The GP refers you to
Refers, yeah.
yeah, refers you to a specialist if you need it. Yeah.
Yes.
Okay. Yeah, that's right. And that's the European system and also the American one. They also have the same thing. If you
Yeah.
have a health issue or something, so you go first
Because
to the
because
GP.
sometimes you have something so the GP can solve or can fix it. Like you don't need to go to the specialist.
Yes, you don't need to go to the specialist. Exactly. That's
Yeah.
why. Yeah. But I think you always have the option to go to the specialist, but it's going to be more expensive. It's going to be
It's
much
more expensive,
expensive.
right? Yeah, yeah, yeah. True, true.
Yeah, it's going to be much expensive. That's why
Yeah,
most people who have insurance, they go to the GP first.
yeah. Because the insurance, like, if you pay something in the GP, you're gonna get it back. But for the specialist, you're not gonna get it back.
Yeah, yeah, you're right about it. And how long does it usually take if you want to see a GP or make an
No, it
appointment with a
doesn't
doctor?
take. Okay, the with the GP, it doesn't take much. Like maybe you just go and they make appointments for maybe next hour or something, and then you come next hour and you go to the GP straight away. So you
Yeah,
don't need to take like 1 day or something like that because the specialist you need like 1 day, 2 days to see the specialist.
yeah.
So
I heard,
if you what is it?
I heard that if you want to see a doctor, a GP, or a specialist, you need to make an appointment by phone first.
No, for me because I'm working in the shopping center, so I have like the GP next to me, so close to me, maybe next door or something, like
Yeah.
next door or the day after. So I just go straight away and I make the appointment like after 1 hour, and then I come back to work and I go back to the GP after that 1 hour.
Yeah, I understand.
So
I got you.
I don't need to call, you know.
Yeah, you just go there and make the appointment,
Yeah,
and
yeah, yeah.
you're gonna see the doctor in an hour or something.
Yeah, maybe it depends. Like if you have something before you or something like that. If
Yeah,
you don't have if you have anyone before you, maybe you take 5 minutes and then you go you see the doctor.
yes, it depends on how rush is it or how rush it is. So if there are many people on the waiting list, you need to wait.
Yeah.
Yeah. Okay. So when was the last time you visited a doctor, a specialist, or a GP?
I think maybe 1 year ago.
Yeah. Why? What for?
I was cutting my finger with the pincer. You know the pincer.
Yeah, you know the what happened? What
I
what
cut it
happened?
because I'm working in a butcher shop in the morning.
Yeah.
So I was cutting the meat. So by mistake, like it's not deep, but I get the leaf. Like I cut the leaf from inside.
Yeah, I
It doesn't
understand.
touch the bone. It doesn't touch the bone. Alhamdulillah, but it cut one of the leaf. So it makes like what is that called? Operation.
Yeah, you needed to make a surgery or to go on a surgery.
Yeah, yeah.
Yeah. Was it a high risk operation?
What was that?
Was it a high risk
I
operation?
w- it's not high, but it was like it took too long to fix the finger to came back to the normal. Like I took maybe 2 months to came back to work.
I
So
understand.
it took too long to fix the finger to make it to make it like before.
Yes, but it took a long time for my finger to recover.
Yes, recover. I want to listen recover.
Yeah, to recover. I
To
understand.
recover. Yeah,
Yeah. Okay, in that case, when something like this happens, like you have an injury or a work injury, do they make it up to
yeah,
you somehow?
yeah. Sure, you have to pay for me.
Yeah.
They paying for me like maybe these 2 months. After that 2 months, I have to go work. So, but like with the tax and with the police and that things, you have to be with the insurance. You have to take your time to recover
To
to that
recover.
recovery.
To recover.
But with the manager, like after that 2 months, that's it. That's enough. You have to go back work.
Yeah, yeah, I understand. So you can take 2 months, or that is gonna be fixed by the doctor. So the doctor says how much time you need to recover. and you
Like
can take this time off.
the doctor said maybe 4 months.
Y-
After 4 months,
yes. So he said
but
that you
after
need to take some rest for 4 months. The doctor said that.
yeah,
Mm-hmm.
yeah. But after that after 2 months, I felt better, so I can work.
Yeah.
So before I was working inside, so I was cutting the lamb and I was cutting everything inside with the knife and with the pencil and that things. But
Yes.
after that 2 months, I just went to do like customer service.
Yeah, yeah. So you left
Just
the work or this kind of work. You don't.
yeah, I just did the like a simple things,
Yeah.
not very hard like before.
Yeah, but was that for also for a short time, or like that's
Yeah,
gonna be
yeah, maybe
forever?
maybe just 1 month or just 1 month.
Yes.
I did that for 1 month and then I came back for the normal.
Yeah, I understand. Okay, so tell me about the process. What happened when you cut your finger or when you have this issue with your finger? What did you do or what happened at this moment? Tell me about the process. What happened?
Like when I cut it or after the injury.
No, 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 no. Tell me before, like when, like now. Imagine that now you are in the situation and you cut your finger. So what did you
Oh
do
yeah.
at the moment? I want to tell you. You
Okay,
want to tell me about the
so
procedure? Yeah.
like for us, you get the whole lamb like it's already killed and it's clean. So you just get the whole lamb, it's whole, and you cut it like cut the chops separate and everything separate
Mm-hmm.
on the pincer.
Yes.
So you have to cut everything separate on the pincer.
Mm-hmm.
So that pincer is very sharp.
Mm.
So if you whatever you wear like gloves or something, you have to anyway you have to wear like metal gloves. And
Yeah.
this time I wear the plastic one.
Yeah. You were wearing the plastic gloves.
Yeah, the medical one, just a moment.
Yes. But this is not a high
That's not
protection.
allowed. No, that's not allowed.
Mm-hmm.
So it's that's illegal. Like the legal one, like you have to wear the metal one.
Why did you do that? Why were you wearing the plastic one?
Because we don't have metal one in the shop. It's very expensive. So no one
Yeah.
get it in the shop.
Yeah, that's why I think the owner of the shop needed to pay you for this because it's
Yeah,
their fault, not yours.
but anyway here, anything happen for you in the shop has to pay for you.
Yeah, I understand because it's a work
So
injury. Yeah.
yeah, that's a work injury. So that's on the shop. It's not you.
Yeah, I got it. So then what happened?
Yeah, and then what else? And then after I cut it, the manager was not here this time.
Mm-hmm.
So it was his brother, and then he took me to the hospital.
Mm-hmm.
I was in Ramadan, so it took me. It was before the iftar.
Mm-hmm.
So I went to hospital, and then I waited in the hospital a long time, maybe 2 or 3 hours.
I waited for three
I just
hours.
yeah waited for 3 hours, but first they put me like what is that called? Like plastic what is that called? I don't know.
Cast?
Maybe I'm not sure.
Yeah, they put it in a cast or something.
Now when you broke your hand,
Yes,
what is
yes,
that?
the
What is
cast.
cast?
They put it in a cast. Yes.
Yeah, they put it in a cast.
Mm-hmm.
Cast CAST.
Yeah, they put
Yeah,
it in a cast like
they
this.
put it. Yeah, they put it in a cast.
Mm-hmm.
And then I waited for like three hours maybe,
Yeah, for about 3 hours, around three
about
hours.
3 hours.
Mm-hmm.
Yeah, roughly 3 hours. And then I saw the doctor, and but after that he said you have to wait for tomorrow because the doctor is gonna do the operation is not here today.
Yes. So
So
they told you, or they told me that if you're talking, Then they told me that I need to wait for tomorrow
Yeah.
because the doctor who's gonna make the surgery is not here. Who's gonna do the surgery is
Yeah.
not here. Yes.
Yes.
Okay, so
And I remember that was the last day in Ramadan. So next day is the Eid.
the next day was Eid.
Yeah, next day the one I did the surgery.
Yeah. So you made the surgery on the first day of Eid.
The first day, yeah.
Yeah. Okay. And how was the surgery?
No, I didn't feel anything. I just got it was a bang. Is it bang?
Yeah, I just they give me some drugs, not
Yeah.
in order not to feel pain.
So I didn't feel anything.
Yeah,
So
so they
I just
drugged
woke
me.
up.
They drugged me. That's how you say it.
Yeah. So they drugged me, and then after that, I just remember that after the surgery, I woke up I asked for food. That's what I remember.
Yeah, you were hungry.
Yeah, I was very hungry that time.
Yeah, I understand. What did they bring you for food?
Maybe it was cheese,
Cheese.
like sandwich cheese.
Yeah,
It was
cheese sandwich.
uh, cheese. Yeah, maybe cheese cheddar, and there is bacon as well, but I don't eat bacon, so I
Yeah.
just ate the cheese.
Yeah. So they give
And
you
I
the
remember
meat. Bacon is meat. Yeah.
I remember the nurse was very nice as well.
What happened? Tell me about
That's
the
something
nurse.
else. No, because the nurse were very kind. That's why.
Yeah.
And she's very, the Australian. So Australian anyway, she's beautiful.
Yeah. I know. Okay. So, speaking of living in Australia, do you have a girlfriend or are you in any kind of relationships?
I used to, but now I realized I realized the thing here. So now I don't have.
Yeah. I understand. So you know now or realize that it doesn't suit you.
It doesn't work here. Like if you're not gonna treat if you're not gonna treat with this like Australian, so like the Australian how they treat with each other. So better to be alone with no girlfriend.
Yeah, but how about to be in a relationship with an Arab? I think it's gonna be different, right?
No, same shit.
Really?
Yeah.
I got it. Yeah. I think.
Most and the Arab here is the worse than the Australian. So the Australian that's normal. She's like that. That's her normal. But the Arab they fake that they are like that. You know?
They fake it.
Yeah.
Yeah. I got you. I got
You know how the Egyptian eat like they act to be like the like the what is that the foreign girls how they act like them.
you. Yeah. I can't
That's how
imagine
the
this.
Arab doing there.
I can't imagine this because we lived here. We experienced this here in Egypt.
Yeah.
Yeah. If you live in some cities like modern cities, you would see that a lot. So I can imagine.
That's the Arab here as well.
I got it. Like
So that's why it's very different to get married here. Like to get married from someone born here.
yes, it's difficult.
It's very difficult.
Yeah, I understand. It must have been very like difficult for you.
It's not impossible, but it's difficult. It's still difficult.
I understand. Okay.
Yeah, still there is yeah.
Yeah, I understand. I got you. Okay. So we have a story today, a conversation between
Yeah.
a doctor and a patient. This patient was experiencing some kind of nagging pain in a part of his body.
Nagging pain?
Nagging pain. Do you know the meaning of nagging pain?
No.
Okay. Nagging pain is like something continuous, if you, from time to time, or when you wake up in the morning, you feel some kind of pain in your back. And this pain is
Yeah.
annoying for you.
Is what? Sorry, no, I didn't hear that.
Annoying.
Annoying, yeah.
Yeah, annoying means like it's continuous and it makes you feel annoyed or feel angry or something.
But that comes every day or just maybe once?
Yeah, it's continuous. No, it doesn't happen
yeah.
like once. It happens more like frequently. So in that case, we can
Yeah.
call it as nagging pain.
Nagging pain, yeah.
Yes, you can say, for example, I have a nagging pain in my leg, in my arm. Okay, so
Like I,
speaking.
like I think everyone has the nagging pain in his back every day. Like when
Yeah,
you wake up, you feel the nagging pain, that pain in your back.
yeah, maybe, but this happens for only for a few minutes or something. So this is normal. But I'm
Yeah,
talking about
yeah,
something
that's.
that lasts longer. You know, so that's
Oh, so maybe that's the problem. Like
yeah,
that's the yeah.
yeah.
So
So
that's
if you
big
have
thing. That's not a small thing.
yes, that's why we
Not
call it.
only pain. Yeah.
Yeah, that's why if you feel that kind of pain, if you feel nagging pain in any part of your body, so in that case, it's a sign that you need to see a doctor.
Oh yeah, yeah, got it.
That's why. So this person
Yeah.
had a nagging pain in a part of his body. We're gonna listen to know which part exactly, and he decided to go to the doctor to see why
Yeah.
he feels this pain.
Yeah.
So we're gonna listen to this story, and after listening to it, we're gonna discuss it. We're gonna like discuss what happened in the story, and talking about the procedures that this person went through. Okay?
Oh, that's good.
Yeah, so let's do it. Let's listen.
Welcome
Yes, let's just a second.
means to have a knife. The dialogue this time is I had a nagging.
Yes, from here.
I went to see my doctor because I had a nagging pain in my leg. After he examined me and did some routine tests, he suggested that I go see a specialist. I made an appointment with Dr. Slope.
Good morning. How are you today?
I'm fine, Dr. Slope. My GP, Dr. Harding, referred me to you. He thought that you might be able to diagnose the problem with my leg.
Well, let's take a look. I want to order some tests, but I think you may need surgery. It's a simple procedure and it'll relieve your pain.
So it's not a high-risk operation?
No, not at all. It's quite routine.
Are there any other treatment options?
Not that I recommend. This is the best course of treatment, in my opinion.
I was really surprised by what Dr. Slope said. I really didn't want to have surgery. I think I better get a second opinion before going under the knife.
Okay, so do you think you need to listen one more time?
Oh yeah, I think so.
Okay.
Routine tests. He says I had a nagging pain because I went to see my doctor because I had a nagging pain in my leg. After he examined me and did some routine tests, he suggested that I go see a specialist. I made an appointment with Dr. Slope.
Good morning. How are you today?
I'm fine, Dr. Slope. My GP, Dr. Harding, referred me to you. He thought that you might be able to diagnose the problem with my leg.
Well, let's take a look. I want to order some tests, but I think you may need surgery. It's a simple procedure and it'll relieve your pain.
So it's not a high-risk operation?
No, not at all. It's quite routine.
Are there any other treatment options?
Not that I recommend. This is the best course of treatment, in my opinion.
I was really surprised by what Dr. Slope said. I really didn't want to have surgery. I think I better get a second opinion before going under the knife.
Okay. How about now?
Yeah, I think so. I got it now.
Okay, so what this is about? Like, what happened to this person? What kind of nagging pain he had?
So he has pain in his leg. So and then the doctor said that maybe he's gonna do something with the like he's gonna do something with the knife in his leg.
Okay, continue.
And then he doesn't like maybe he doesn't like that, and so he asked for something else for the treatment, like any other way.
Mm-hmm.
And she said that maybe that's the best way. So that's the best plan for the treatment.
Yeah. Okay. So, How about his feelings? What did he feel? Did he feel that he wants to make the surgery or not?
No.
So what did he decide at the end of the story?
I think maybe they decide to try something else before to go to under the knife.
Yes, he decided to like go to another doctor.
To get another doctor.
Yes, to see another doctor or
Yeah.
to go to another doctor before making the surgery. Yes. Okay.
Okay.
So as you can see in this story, there are many expressions they used related to this, to seeing a specialist or seeing a doctor in general. That's why now we're going to listen to this story again, but this time we're going to listen a piece by a piece to get all the expressions they use. Okay?
Yeah.
Yeah, so let's do this.
Oh, under the night. I went to see my doctor because I had a nagging pain in my leg.
What did he say here?
I want to see the doctor because I had the nagging pain in my leg.
Okay, did he say I want or I went? What do you think?
I went.
Yes, he said I went to see my doctor.
doctor.
Why? Why did he go to see the doctor?
Because I have a nagging pain in my leg.
Okay, actually he didn't say I have because he's talking about something already happened in the past. So in that case,
I had
yes, I had. What did he have?
a nagging pain in my leg.
A nagging pain in my leg. So if I ask you here this question and say, what kind of nagging pain did he have? So it's gonna be
He had a nagging pain in his leg.
yes, exactly, perfect. Let's continue. Have you ever had any kind of nagging pain?
Maybe just that one in my back. Because usually I just I get some boxes from the floor and I put it like up the shelf.
Yeah, you lift
And
them. You lift them
and I
up.
left and I left the whole lamb a lot. So and I left the beef as well. Maybe that's like 120 kilos.
Yeah, I
So I always
understand.
feel that nagging pain in my back.
Yeah,
My
so
back.
I think you need to follow some instructions in order not to hurt your back because this is very important.
I just need to go holiday. That's what I
Yeah,
need now.
you need to take a vacation. I just need to go on a vacation, or I just need to take
Break.
a break or some days off. Yes, some days off.
Some days or some weeks. I don't
Yeah,
mind.
yeah. So that's what we call a break. So the break may be longer than a few days. Yeah,
Yeah.
yeah. Okay, let's continue. And to be honest, all of us need to take a break. Everyone.
Oh yeah, sure.
And we need to go to an island or something.
Yeah.
Yeah. Okay, let's continue.
After he examined me and did some routine tests,
After examining me
After
and do some
mhm,
examining me.
after he examined me, but actually we don't say examined me. We said like examined me.
After examining me and
Yes.
did some routine tests.
Yes.
Oh,
Some routine test. What does it mean? What's the meaning of routine test?
like routine test. Routine test. Maybe like move your leg. Go walk, run to see how your legs working.
Yes, exactly. So routine test is like something that usual test,
Yeah,
like
just like maybe just see there how normally your legs work.
yes, exactly. So after the doctor examined me and did some routine test, what did he do or what did he decide to do?
he suggested that I go see a specialist.
He suggests that I should go to the specialist.
He suggested
He suggested
that I go see a
that I
special.
go see that as specialist.
Yes. So that's how you say it. For example, if you feel any kind of pain and you tell your friend or tell a friend about it, so maybe he suggests that you go see a specialist or something, or to go see a doctor, right?
Yeah.
Yeah. So
I made an appointment with Dr. Slope.
I made an appointment with Doctor Slope.
I made an appointment
With Doctor.
with Dr. Slope. That's the name of the doctor, you know? Yeah. Okay. I have a question here. Since you live in Australia, if you go to see a GP and
Yeah.
the GP sees that you need to see a specialist, does he refer you to the specialist or you need to make the appointment yourself?
No, he referred me.
Yes, he refers
Yeah.
you.
Yeah, he refers me.
Yes, he refers you to the.
So he just telling me the appointment like tomorrow or something,
Mhm.
and then I go straight away. But I did everything by himself.
Yeah, so he just informs you about the
Just the
appointment.
appointment. Yeah.
Yes, about the appointment,
Yeah.
and you go there. I just go there.
Yeah.
Yes, and you just go there. Yeah, I understand. Okay, let's continue.
Good morning. How are you today?
What's this?
Good morning.
What is it about? What's this here? What's the situation?
Good morning. How are you today?
Yeah, I know, but I want you to tell me
No problem.
what is this situation? Where are they now? And who said that?
The specialist.
Yes. So now this is
Like he went to the specialist to see the
Yes.
specialist, and that's how the specialist when she saw him, what did she
yes.
say?
So she started the conversation saying, "Good morning. How are you today?" Yeah.
Yeah.
Okay. Let's continue.
I'm fine, Dr. Slope. My GP, Dr. Harding, referred me to you.
I'm fine, Dr. Slope. My GP, Dr. I don't know what's his name,
Harding.
referred me to you.
Yes, Harding. Yeah, that's the name of the doctor. Okay, it doesn't matter. So
Yeah, referred me to you.
yes, my Dr. Harding referred me.
To you.
Yes. So he started saying that referred me.
Me
Yes.
to you.
To you. Exactly. Okay.
He thought that you might be able to diagnose the problem with my leg.
Can you try it again?
Okay.
Okay.
Referred me to you. He thought that you might be able to diagnose the problem with my leg.
He thought that you may be able to. I don't know.
He thought that you might
Maybe able.
might be
Might able.
yes, might be able to do what?
Able.
If the-
Something in my leg. Like,
Yes. Actually, when you see a doctor or when you have a problem, any kind of a health issue, and you go to see the doctor examines you. Examines you means like to see what's going on, what's wrong with your leg, or what's
Yeah.
wrong with you, why you feel this kind of pain or this kind of problem. So in this case, we can say that he examines you. And after he examines you and asks you to do some routine test or something, so he knows that, or he knows the kind of problems you have. Okay? So in that
Yeah,
case,
so-
realizing and knowing,
so
so
he
this
has
is.
to. So he has to examine me first.
Yes, so after he examines you, he did this already. So
Yeah.
now he knows why this happens to you. So in that case, we can say that he diagnosed the problem. That means that
Diagnose.
he identified it. He knows now why you feel this. He knows what you need.
So he knows the problem now.
Yes. So he thought you might be able to diagnose,
Diagnose me.
the
My
problem
leg.
with my leg.
The problem.
Yeah. So listen again.
Diagnose.
Listen to it again.
He thought that you might be able to diagnose the problem with my leg.
So that you might be able to diagnose the problem with my leg.
Yes, and it's not diagnose, it's diagnose.
Diagnose
Diagnose the problem with my leg. Yeah.
diagnose the problem with my leg.
Yeah. So it's like
It's very hard.
no, it's not hard,
Maybe
you
I
know.
can't, maybe I can't remember after that. Like after the course, I can't remember.
To be honest, I'm gonna be sending you this file as usual, so you can get back to it.
Yeah, okay, but like, what, like, if I have it, maybe I can't remember it. Like, I want to keep it in my mind. So if I want to remember it, I don't go back to the file. You know what I mean?
I understand, but you need to know how that works. Okay. So, for example,
Yeah.
when we study a topic, or when we discuss a topic, or practice it, or talk about it in our session like this, you're gonna have an assignment every time that you need to do after the session, and this
Yeah.
assignment is to practice on the topic we discussed. This practicing is like to imagine that you are in the situation, so you make some stories related to it, and you
Yeah.
practice on using it a lot in your day. For example,
Because that's happening with me every day. So if I talk with someone, like if I talk with someone, we talk about something about any topic. So I got some words, some new words, but I can't keep it.
yeah, that comes by practicing. When you get the new words, you need to use them in your day. For example, now we learned the new word, which is to diagnose, right?
Yeah.
So I can now, after the session, I can go and say, yeah, I think I have some kind of nagging pain in my shoulder, and I need to go to see my doctor to be able to diagnose the problem. Yeah, I remember last year I went to see my doctor, and I had some kind of nagging pain, and when he diagnosed the problem, he told me that I need to make a surgery. Got it?
Yeah.
I remember my friend had some kind of nagging pain in his stomach, and when he went to the doctor, he diagnosed this problem as leukemia or any kind of disease. Understand?
Yeah.
So now I'm using the word in different contexts, in different situations. So if I do this a lot and I practice using it in my day, I will be able to remember it, and I'm not gonna forget it again. Understand?
Yeah.
So that's what I want you to do. When you learn a new
So you're
word,
gonna have to. So you're gonna have to. I have to use it in my daily,
of
routine,
course,
like my daily talking.
if you didn't do this even in the simplest situations or dialogues, you'll not be able to recover and recall them. So you need to do this in every topic we say or we talk, we discuss.
Yeah, that's what I'm saying. Dude. Maybe that's my fault because always when I eat something, uh, I can't remember after that. Like if we talked about it now, after I go outside, if I want to say it, I can't remember it. You know?
Yeah, I got you. I got you. But like, if you want to get over this, you need to practice everything you learn. Like, it's not just about memorizing. I'm not giving you here a list of words that you need to memorize. I'm not doing this here. What I'm doing here
Yeah.
is practicing and like giving you the chance to practice more and putting you on the right track. Got it?
So like you have the chance to talk more, to talk with someone more. That gives you like the like more words, more everything. At least more confidence, so you can talk. You don't feel shy when you're talking. Like
Yes,
that.
exactly. So this combination is what we're doing here. It's a combination, like helping you to like to speak more fluently. That's the thing, and also improving some kind of pronunciation if you need it. Yes, exactly. That's something we do, and also giving you some new vocabulary and expression that you can use in your day. That's another thing. And also you have you make some grammar mistakes, like you make a lot of grammar mistakes during speaking. Sometimes you talk about something in the past and you make it in the present. So we also gonna be working on that, because
Yeah.
sometimes people might get confused when you speak that way. For example,
But I think the like no one care about the grammar. Yeah, if you talk to someone, as long as he understand you, so he doesn't care if you talk with the grammar mistakes or not.
yeah, that's the point. Sometimes, like when you change in the grammar, it changes the meaning somehow. For example, let's say that you talk about one of your friends to another friend, and you always say he was so
Yeah,
kind, and we were so friends. We were close friends to each other, and he used to be kind to me. If you say that, the other person who listens to you will get the impression that this person is no longer here. Maybe he died.
yeah.
Maybe you're not friends anymore. So that's something he got from the grammar you used. Got it?
Oh, yeah. Okay.
So
Got it.
sometimes using the grammar the wrong way might give some kind of confliction in their understanding. Understand?
Yeah,
So
yeah,
that's what I'm talking about. I'm not talking about the simple mistakes or simple grammar mistakes like when say he has or he have. No, I'm not talking about this. I'm talking about the major grammar mistakes that might give confusion. Got it?
yeah.
Yeah, that's what I'm talking about. That's why, or that's the importance of grammar. It's not just about like simple mistakes. Sometimes people might get confused when you speak that way. Understand?
Yeah.
Yeah. Okay. So I expect from you after every session we finish, after every topic we discuss and talk about, to practice it more, to use the words in your daily life. Like try to make examples and use these words in. And I
Like
assure
with
you,
myself.
yes,
Yeah.
think out loud about something. Like I give you some examples now. When I told you that I'm talking about last year when I went to the doctor and he diagnosed my problem, and my friend when he went to the doctor and doctor diagnosed this problem, and I want to go to the doctor so he will be able to diagnose my problem. So all of these are examples. Got it?
Yeah, because I have my uncle here. He's here maybe like 20 years 20 years ago.
Yeah, he's been here for
So
20 years.
we've been we've been here from 20 years ago. So he was talking. If he was saying, if you wanna learn, like talk with yourself in the middle. You
Of
know,
course. And
like make a conversation with with yourself in the middle.
yeah. Like it works in many kinds of aspects. For example, as a teacher, as an instructor, I help people to speak. And if I wanna prepare, if I wanna train myself on doing this, I stand in front of the mirror and try to talk and imagine that I'm talking to someone. This is very useful, you know.
Yeah,
Sometimes if I want to prepare for a presentation or a speech or something like this, I talk to the mirror.
yeah,
Yeah. So
yeah. It
this,
works.
yeah, it works and it's very efficient. Yeah.
Yeah.
Okay. So let's continue.
Well, let's take a look.
Well, let's take a look.
Let's take a look. Let's see what you have. Yes.
Yeah.
I want to order some tests, but I think you may need surgery.
I want to order some tests, but I think may need a surgery.
Yes. So if when the doctor asks you to make some tests, so he orders, I want to order some tests. So that's the meaning, or that's how you say it. The doctor
Yeah.
ordered me, or the doctor ordered some tests. Yeah, doctor orders some tests.
Order some tests like they test you first.
No, order some tests means he asked you to make a blood test, an X-ray,
Oh yeah.
something like this. That's the meaning of he ordered some tests. Understand? Yeah. So the doctor here said,
Tests, but
no.
I want to order some tests, but I think you may need surgery.
Yeah.
I want to
I think
order
maybe
some.
need. I want to order some tests, but I think maybe need the surgery.
Yes.
It's a simple procedure and it'll relieve your pain.
The simple procedure.
Yeah, it's a simple.
The simple procedure.
Yes. Mm-hmm. Yeah, it's a simple procedure on what? Listen again. Listen
yeah.
again.
Procedure, and it'll relieve your pain.
Relieve your pain.
Yes, he said here like a very tricky combination of words. He said, and it will, and it will. I know it's difficult to figure or difficult to
Yeah.
realize because she said it so fast. And it will,
Because
and it'll.
that's what happened with me. Yeah, like really, when I took the Australian, it's very hard because the Australian is the most faster language, faster accent.
Yeah, the fastest accent or the fastest English accent.
Yeah, the fastest English accent. Like the England, if there's someone from England here, they talking. I feel like I'm talking with the normal people. Like they talking very slow.
Yeah, but you
But
can't
the
say the
Australian is
same.
very fast.
Yeah,
You
Australian
can
and
catch
Scottish.
the words.
Yeah, Australians and Scottish people, like they have the weirdest accent. Yeah.
Yeah.
So it's a simple procedure, and it will relieve.
And will relieve
Yeah,
your pain.
relieve your pain. Listen to it again.
It's a simple procedure, and it'll relieve your pain.
What's procedure means?
Yeah, it's a simple procedure. She's talking here about the surgery.
Yeah.
You know, when you say that the surgery is a simple procedure, that means it's not difficult. It's
Yeah.
not dangerous.
Yeah.
Yeah. So the procedure means the process.
Oh yeah.
Yeah. So
Yeah.
it's a simple process or a simple procedure, the same meaning. Okay. So he said,
Okay.
So it's not a high risk operation?
So it's not a high risk operation.
yeah, he's asking here. It's not a high risk operation. So he's using his intonation now to ask. You know,
Yeah.
he used the intonation. That means the tone of voice.
Oh yeah. So it doesn't like that. That's not a question. Like that's not the type of the question. So it start with the it's not. So
Yes.
that like you talking normal, but they use the voice note, like the voice vote
Yeah, it's called intonation.
intonation.
For example, when I say hungry,
Yeah. So the tone of the voice.
yes, the tone of your
That
voice.
means
Yeah.
yeah.
So
That means that you're asking.
yeah, and it's very common, you know, nowadays everywhere when they ask a question, they use the intonation instead of using the formal way of asking
Yeah.
question.
And no one used the formal the formal sentence.
Yes, exactly. They always use the indirect way of asking questions, and they use intonation
Like
instead of this.
like you're going home. You're going somewhere.
Yes,
Like
exactly.
that.
Exactly. That's it. So you need to train yourself doing this because this is very important and it will make you more understandable.
Yeah.
Yeah. Okay.
No, not at all.
No, not at all.
Yes, exactly.
It's quite routine.
It's quite routine.
She said it's it's
Quite
quite,
routine.
yes, quite routine.
Routine.
Yeah, it means very routine. It's not like not risky at all.
Yeah.
Are there any other treatment options?
Are there other treatment options?
Yeah, are there any other treatment options? Yeah, that's the question. Are there any other treatment options? What does it mean? Like what is he saying
Like,
here?
like, is there anything else? Any other way?
Yeah, any other alternatives of the for the surgery? Yes. So that's the kind of question you can ask. For example, let's imagine that when you went to the doctor after the injury you had, and he said that you need to make surgery. So maybe you ask, are there any other treatment options instead of going on the surgery?
Yeah. Are there any other treatment options?
Yes, exactly.
Not that I recommend.
Not right? What's that? Yeah?
Listen again.
What I recommend?
Yeah, she said not that I. That's how you say it. That I. Not that I.
Not that I recommend.
Yeah, recommend. That means like there are many some other treatment options, but I don't recommend them. Understand?
How did she say it?
Not that I.
Not that.
Not that
Not
I.
that.
Not that I.
Not that I.
Yes.
Not that I recommend.
Yes. Listen again.
Are there any other treatment options?
Not that I recommend.
Not that I recommend.
Yeah.
But yeah, they say they recommend. They say recommend.
Recommend.
Like
Recommend.
like here, when someone asks you, are you recommend to do like something?
Yeah, I recommend.
Like,
Yeah,
you
they
do
make it like
breakfast.
they make it like recommend, like this.
Yeah.
Yeah, this is maybe
Like
the difference.
They say like, are you recommend? Like you can't hear the recommend. You can't hear the D.
Yeah, maybe because they link it with some other words, following words.
No, if whatever they saying, what do you reckon?
Yeah, so maybe that's
do you reckon?
one of the the differences between the American accent and the Australian one. Maybe.
Yeah, because the Aussie slang is very hard here.
Yeah, I
There's
understand.
some words that you can't hear that like you can imagine that this words are like recommend.
Yeah, I understand. Got you. It happens. It always happens, to be honest. And even in America, you look, sometimes they use different accents in different states, you know. So, for example,
like,
this accent we're studying here, this is for North America.
Yeah.
Yeah, so maybe this is a little different, or it has some differences between the accent they use in different states in America, you know.
Yeah.
Yeah.
Like here they don't say the T.
Yeah,
T they don't say T like that. They don't say that. They say that.
you said that. Yes, it's also American. They use like she said here, not that I. It's not that I. You know that I.
Like,
And sometimes, for example, a word like appointment. It's not appointment. Appointment. Yes. Okay. So let's continue.
This is the best course of treatment, in my opinion.
This is the best course in the treatment, in my opinion.
The best
Of the
course.
treatment,
No, of treatment. Of treatment.
in my opinion.
In my opinion. Yes. So this
The
is
best course of treatment, in my opinion.
yeah. Course of treatment. Course of treatment.
Course of treatment.
Yes. Okay.
I was really surprised by what Dr. Slope said.
I was really surprised with what Dr. Slope said.
Yeah, I was really surprised. And when you're surprised by something.
Okay, surprised by
What
what Dr. Dr. Slope said.
Said. Yes. As you can see here, it's not gonna be I was, it's gonna be eyes.
I was really surprised by what Dr. Slope said.
Yes, exactly.
I really didn't want to have surgery.
I didn't want I have surgery.
Okay, I really didn't wanna
Have surgery.
have.
I really didn't want to.
Yes, I really didn't wanna.
I really didn't want to.
Yes. Okay.
I think I better get a second opinion before going under the knife.
I think I need to get a second opinion before getting under my knife.
Yeah, I think I better. You know, it's always used. It's very used to use the word better instead of saying I should.
Yeah.
Yeah, I better. So I think I better. That means I should. I think I should.
I think I better get another
A
opinion.
second,
Second
a second opinion.
second opinion.
Yeah, a second opinion here means like I need to see another doctor. I need to go to another doctor to ask them.
Okay.
Maybe they have
Okay.
different diagnosis.
Okay.
Yeah, I think I better get a second opinion before
Going
going
going.
going under the knife. Yeah, before.
Will I get this will I get that like the grammar in the IELTS course?
Okay, in the IELTS course, it's very important to pay attention to the grammar and to pay
Yeah.
attention to using new expressions. This is very important, the IELTS course.
Yeah, that's something because I feel I have a lot of mistakes in the grammar.
Yeah, that's why. And that's what we're like, that's why I told you that you need to learn more about the grammar. It's very important, you know?
Yeah, that's what I'm planning to. Like after this, I'll start the IELTS course because I'm gonna do the IELTS test after this.
Yes.
Maybe after 1 month, 2 months.
Yes. So we're gonna prepare you for this. It's gonna be for like you're gonna take the IELTS course with another teacher, like one of our team teachers, and he's gonna train you for the IELTS course. You're gonna practice
Prepare for the everything like the full
the
what
four
is it, the
skills.
full course.
The four skills.
Yeah.
Because the IELTS course or the IELTS test includes 4 tests: the speaking, the writing, the
Yes.
listening, and the reading. So you're going to be practicing all the skills.
Yeah. So that's good.
Yeah. Okay. And to go under the knife here means to make the surgery. So it's not
Yes.
literally, going under the knife means going on the surgery. Got it?
I got it.
So he said here, I think I better get a second opinion before going under the knife. So that's what he said. Yeah. Okay. So your assignment for today's session is to tell me some stories related to seeing a specialist. Maybe your story, maybe someone else's story, like a friend of yours, or maybe a family member or something. And I want you to use all the expressions we used in today's story in your story, okay?
Yeah.
It's not about writing. I don't want you to write the story. I want you to record it in a voice record so we can listen to this voice record together next time, inshallah. And when we
So
listen,
can I look at this one or I have to speak without looking for these ones?
okay, you need to study them first. I'm gonna send you the script of the story. You practice it, you train on it, you study it. And after this, I want you to make your own story without reading, without seeing anything.
Alright.
Got it?
Okay.
Yeah.
Yeah, got it.
And feel free to make mistakes. No problem.
Yep.
Because the more mistakes you make, the more you learn and the more you become fluent.
Good.
Yeah. If you have any question, you can ask me.
Yep. No, I think that's it, guys.
Thank you so
Thank you.
much. Thank you so much, Mehand, and see you inshallah
Thanks.
next Monday.
Inshallah. Thank
Thank
you.
you. Thank you. Bye.
See you. Bye.